I'm going to discuss a problem with the IHS that I think should be fixed. And according to Beatrix Hoffman in Healthcare for Some in 2012, one reason that most people don't seek a healthcare degree is because they don't have the money to afford it. More healthcare professionals will be added to our workforce, the IHS, if there was more scholarship funding for pre-healthcare degrees. And this is important because scholarship funding is an important resource to almost everybody who seeks a college degree. And today we're going to look at the problem of financial assistance for more pre-healthcare degrees, how we can fix this problem, and how we're going to implement the solution. Let's begin by looking at the problem of financial assistance for pre-healthcare degrees. According to the Indian Health Services Scholarship Application Handbook in 2011, there are only 7 degrees that get funded through this scholarship. That scholarship being the pre-professional healthcare degree. So if someone was going into physical therapy and they wanted funding for the 4 years it takes to get a bachelor's degree, they couldn't get that funding until they get into physical therapy school. Overall, there are 17 healthcare degrees that the IHS scholarship covers. So that leaves out 10 degrees that don't get funded the 4 years prior to getting into medical school. Most Native American students can't consider the healthcare field as a profession because if they can barely afford the 4 years of college it takes to get a bachelor's degree, medical school is just out of the question completely. And college is expensive. Tuition, fees, books, it definitely adds up over the period of 4 years. And then to have funding for the 3 or 4 years it takes to get that doctorate degree. And so it's a really, really big problem within the Native American communities. Now we've discussed the problem, now we're going to look at the possible solutions. To any problem, there has to be a solution. There has to be. Of course, we need money to fix our problem that we have within the IHS. I think that we can allocate more funds toward the scholarship program. And if that means that we have to cut programs that are less effective, then we need to do it. Because scholarship funding should be a priority, and it should be important to our IHS community. And we should encourage partnerships with other sources that can supply more funds for this purpose. We can partner with other philanthropies, other Native American organizations, or other tribes as well. Now we know that there's a problem. We've discussed possible solutions. Now we can discuss how we're going to implement this solution. How are we going to start the solution? Where are we going to begin? We can inform students of all the opportunities that they have, that are available to them. We can raise awareness about our scholarship program. Make scholarship funding a priority. Students should know that we want them to be healthcare professionals. We want them to have a better life than they had growing up. We want them to be a part of our healthcare workforce. If they know that we're here to help them, then they'll reach out and they'll grab a hold of the opportunities that are available. And I think that we should recall that we are to deliver effective and efficient healthcare to all the federally recognized tribes. And by adding to our workforce through scholarship funding, we'll be able to do that more effectively. Now we know the problem, we know the solutions, we know the implementation, we know where to start. The IHS can add to our workforce if there is more funding for pre-healthcare degrees. I've expressed the problem of financial assistance, I've talked to you about possible solutions, and I've talked to you about where to begin and how to implement these solutions. According to Robert Hackey in Cries of Crisis in 2012, healthcare should be a priority. By adding to our Native American workforce, we can keep that a priority and we can make that our #1 priority.